All right, looks like we've got a great group assembled here. Thanks again for joining the webinar. Thank you for MedChi for supporting this webinar today on how to evaluate AI tools for your medical practice. I want this to be a practical conversation about a topic that in many ways feels impractical. So we'll attempt today to break this down into really some easy steps that you can follow as you look at AI tools in your medical practice. Let's talk about really what the challenges are today with this process of evaluating AI tools. First of all, there's a lot of vendors out there, and every day we're seeing more vendors come into the AI space for medical practices, and it's confusing. At the end of the presentation, we'll talk about a PEAKE initiative to help break through some of that confusion. But the reality is there's going to be a lot of tools out there and a lot of noise. And you'll probably look at many over time. There's certainly a lot of hype around AI and AI use in medical practices versus really what the reality might be. So that's again something that we have to work through. And there's really, if you just think about AI tools, not a playbook for how you evaluate these. What we would say is that you can use a playbook from the software selection process to evaluate AI tools. So we'll dig into some of that today, as well as some tweaks in terms of how to make that apply to AI tools that you're looking at. Some things that we'll learn, um, why some of these processes fail in medical practices, whether it's an AI tool or another type of software product, um, questions that you can ask, or a framework that you can create for establishing your process for AI tool evaluation, and what to do as you prepare for a demo of an AI tool for your practice, as well as the next steps that you can take today. We have a lot of content to cover, so I'm going to keep things moving. We do have the ability for you to ask questions, which you're welcome to post as we go, and then we'll leave some time at the end for the questions as well. So one of the things that we think about is just software evaluation in general and why sometimes it's challenging in the healthcare environment. And first of all, it's a unique environment. There are many regulatory and compliance requirements in healthcare that you may not see in another business. So that's certainly something that is always needs to be taken into consideration. And we have complex integrations, not just our EHR, but also our billing systems, scheduling systems, any other clinical tools that you're using, procedural systems. And these integrations have to work for the tool to work. And this is something that's unique in the healthcare environment. And this is really a no fail implementation in many cases. We're using AI or software tools to improve patient care, or to improve the patient experience, or to improve efficiency. And the margin for error is very limited to none in a healthcare environment. So the way that we approach evaluations really needs to be unique for healthcare. And it doesn't help that some early implementations of AI have raised some concerns. We believe that some of this is a software solution chasing a problem. In other cases, it's maybe the incorrect application of the technology, or maybe the software itself is not ready. But there are a couple of studies recently, an MIT study that says that 95% of AI implementations have failed to really show a return on investment. It's early. And we know there are some early adopters of technology that are going to have some of these types of challenges. But in our practices, where every day, every minute, every dollar counts, we really want to do things to reduce those missteps. And in the Time article showed that in some cases that AI actually made cancer detection worse. So it's important that we get these right. It's important that we're solving the right problem. So let's kind of step into this approach a bit as we go. First thing we need to do is step one, define the problem. When we think about AI in our practices, really needs to be focused on solving a problem that we have already or that we've identified in our practice. Because AI is not going to be a catch-all for all solutions. And there are applications where AI makes sense, and then there are some where it doesn't make sense. So if there's a repeatable task with a clear process, then AI or automation in many cases could make sense. And as we've all seen, that these large language models have made significant progress over the last few years, but they're good at certain things and not necessarily good at others. So let's talk about this framework, this question framework that we've developed that we would suggest you kind of use in this process. And this helps us decide whether a problem that we're solving is right for AI. And this really comes from solving real world problems. So the first question that we would start with is, what problem are we trying to solve in the practice? Uh, is this an efficiency issue? Is this a quality of care? Is this a patient experience problem? And what level of pain is this causing in the practice? What type of impact is this problem having? Who does it impact? Is this really our providers, the patients, some other stakeholder? And what's the cost of ignoring the issue? So I would say, whether this is an AI tool or a software solution, the way to start with the process is really talking about the problem that we're trying to solve. There's the saying, if it's not broken, don't try to fix it. I think that certainly can apply here, but there's always things that we can try to fix and make better in our practice, whether it's building efficiencies or finding additional billing opportunities or improving the customer experience. But starting out by saying, what problem are we trying to solve, is a good first step and first question. The next is determining if it's AI appropriate. Is this something that's going to reduce an administrative burden? Is there a unique fit for AI and language models or automation in solving this problem? And does the product or the software tools that we're already using have a capability gap? Many of the AI tools that we're seeing and that you've probably seen are tied into or part of your electronic health record system. And the EHR vendors are, in many cases, are making great progress in bringing AI tools into the platform. So it may be a problem that you're solving that your EHR vendor is already working on. And that, in many cases, would be a better path than looking for a third-party solution that needs to get integrated. So we're asking the question, is this an AI appropriate problem for us to be solving? The next question is defining success. What does success look like in this process? So we've defined the problem. We've answered the question if it's AI appropriate. Now we're looking at success and coming up with some definition that's tangible of what success looks like. Is it in a number of minutes reduced in note taking? Is it I heard one recently, which was the number of hours after patient care hours that a physician is spending inside of the EHR and actually trying to measure that reduction. Is it improvement in your patient satisfaction survey results? Is it a reduction in the number of abandoned calls through your call center? Likely related to the problem, there's something measurable that we can define that we will use through the process to measure success. and maybe success is multidimensional, then we really need to define what those different dimensions of success look like in our implementation of an AI tool. The fourth question really speaks to your organization and the culture and the willingness for change. Are you ready for change? Is there a foundation to build on within the organization for change? Do we have clear ownership of the process of moving this AI solution from concept or identification through to implementation and measurement? Do we already have processes in place and documented? That goes a long way to assuring AI success if you already have something in place that you can build from. Because the AI solutions will introduce change in an organization, and that change can be interpreted in different ways based on the stakeholders within your business. So I think if done right, this is a process that can bring everyone along versus you leaving some behind. But you do need to think about your readiness for change. And the last question is about error and tolerance for error in the solution that you're implementing. If this is part of a clinical decision-making process, the tolerance for error may be little or none. If this is about customer interactions or customer satisfaction, post a procedure or post an interaction, maybe there's a little bit more room for error. So the how and where you're using AI in the practice and based on the problem that you're trying to solve will certainly inform the error tolerance, which will then bring us back to the question of, how closely do we need to monitor the process as we're going through implementation. Once you've asked those questions, you've defined the problem, you're ready for the change within your organization. You've talked about your error tolerance, and you've identified some products. You're going to be at the point where you're ready to engage with some vendors and see a demo. But there's a decent amount of work that can be done prior to the product demo in this pre-demo due diligence that will, in some cases, filter products out that are not a fit. In other cases, will put you in a better position for the demonstration and then also later a pilot within the organization. So when we're in demo due diligence, we know that there are some unique things that really become non-negotiables. And this is part of the conversation with the AI product vendor. Do they already have EHR integrations? Do they have a strong answer around security and compliance? Do they have references of practices that are similar to yours or similar to size or similar deployments? These are questions that can be asked and answered before a demo ever occurs, and these really should be non-negotiables. Likely, you're either wasting your time or you're too early to this product if the vendor can't answer these questions affirmatively and with some confidence. And in some cases, it's okay to be an early adopter. Again, it really comes back to the error tolerance question and kind of the culture of your organization. Are you willing to try a product that might fail to be an early adopter or a leader? In many cases, that comes down to your culture. But these are questions that we can ask out of the gate that may qualify or disqualify a potential product vendor. The compliance one is really another one that the vendor can give you some answers prior to a demonstration. How do they handle information security? Of course, if this is a platform that's going to have patient identifiable information, they're going to be a business associate and they should have a clear process for engaging in a BAA. You should review the BAA, or it's potentially your BAA to make sure that you're covered and that the vendor is doing things on their end to make sure your data is secure. Now, the BAA itself really isn't going to give you that answer. So one of the things that, in terms of if the vendor is doing the right things to secure your data, what would recommend is to fall back to industry standard security accreditations to validate their ability to keep your data secure. And two that are very common would be a SOC 2 certification for their data center and their data infrastructure, and or also ISO 27001. Both SOC 2 and ISO 27001 are industry standard information security accreditations that you should expect from a software or an AI vendor that's working in the healthcare space. These, in some cases, would be certainly if it's patient identifiable information in the system, a non-starter if they're not able to answer this question affirmatively that they have this taken care of and that they can share the documentation of that certification with you. The devil's in the details. So are they just in a SOC 2 data center, or is their implementation of their software actually SOC 2 compliant? In this case, you probably would want to work with your IT vendor, or if you have an MSP, or you're working with a consultant on identifying the AI tool, they can help you dig into these certifications and give you some assurance that the vendor really has their IT, information security and compliance house in order. Your EHR integration is going to be important, and it's something that can really be a reality check in the conversation early on. What you will probably hear, and what we would call this is the tip of the iceberg, is that they've got the open platform. They have either APIs or webhooks, or they have some other type of integration capability that would interface with your EHR. But just because your EHR has an API and their tool has an API does not mean at all that these two systems are going to be compatible. So really what we want to do is ask the question under that, which is explain this and show us and tell us more about how you're doing this integration. Has there been a workflow design that specifically works with your EHR? And Athena is going to be different than ModMed, is going to be different than Epic when it comes to workflow design. What's the user experience? How do my users actually interface with the technology? Is it standalone and outside of the EHR? Is it inside of the EHR and fully integrated? And is this tool that is supposed to be adding efficiencies to our organization, adding any new redundant processes? So when we get into the integration reality, there are questions that can be done again pre-demo that will help us understand how well this product has already been thought through in the context of our EHR environment. When we think about the world of AI vendors, again, many out there, but not all created equal. Some may have an application that can be applied to any type of business case, and others might really be specific to healthcare. So we believe that a good vendor is going to have healthcare case studies, so you should be able to see that. But if they have just generic examples that are not really aligned to your practice, that's not a path to success and to excellence. If you have a AI vendor that has really thought through this product and solution, they're going to be able to show you practices like yours of similar size, that are in your same specialty, that have your EHR, and that have a compatible patient population. That's really going to be a key to success, is that you've got alignment along these items, which are going to lead to the product success ultimately. Now we get to the product demo. So we've defined the problem, we've walked through the solution, we've done all this pre demo, due diligence, check, check, check. We're all green lights. Now we're at the demo itself. It's ideal to have a champion within your organization, or what we would call the problem owner, who is assigned and dedicated to walking this product through to an ultimate solution. And then you want to have the right team assembled for the demonstration that cuts across different stakeholder groups within your organization. And obviously, this will be dependent on the AI tool or the AI solution that you're evaluating. But think outside the box a bit. If it's a clinical solution, have some administrative representation in the demonstration. You may find that there are questions that they're thinking about, or ancillary problems or downstream problems that they're thinking about that may not be immediately evident to a clinical decision maker. So have a cross section of end users that includes the owner, some other end users, and the decision maker. Communicate your definition of success. We talked about that earlier. You've got that definition defined. You've got some metrics. Share that with the software vendor. Share that with your team, and make sure that you're all on the same page so that you're working towards solving the same problem. And certainly come with your real world scenarios. It's great to prepare the AI tool vendor with your real world scenarios ahead of time so that they kind of already thought through those and come prepared to really show you the product relevant to the things that you're asking about. And here are some questions that in many cases can help you along the way, and we'd be glad to help you with other questions or the evaluation process. But um, there's this concept of hallucinations and essentially wrong answers that are coming out of the AI. How does the AI vendor identify those, deal with those when they occur? Is there a feedback loop? Where are humans in the loop? How does this vendor and you as the user train the model, but also your staff and how to use these tools? If this tool is going to be a software as a service, which many are, and then it's going to be integrated into your tools, which are probably also software as a service or are hosted on your servers, then there's this integration that now becomes a new breaking point for your system. So what guarantees does the vendor have around updates, and how do they handle, what guarantees do they have around uptime? Next one, which would be how do they handle updates to their system and software changes? Because as we know, software changes, and when it does, things tend to break, and we want to make sure that we're minimizing that. So some red flags, and I'm going to speed up a bit because we got a lot more things to cover. And these slides will be available to all the webinar attendees today and participants that registered, so you'll have these to you. If the vendor doesn't have healthcare experience, if they don't have security and compliance accreditations, these are some red flags. Some yellow flags that would require some deeper digging in would be vague integration claims or lack of clarity around how they train the system or train your user, or a desire for long-term contracts that don't have much flexibility. So these would be yellow flags to think about as you're interacting with the vendor. So we've talked about some of these things, but to kind of recapping, define your problem and your outcome, create your list of non-negotiables, build your list of demo questions ahead of time with the right team at the table, have a clear timeline for also piloting the solution once it's in place, and really decide which references and case studies are most relevant to you. These are a number of things that kind of work in your process of evaluation. I'm going to go through this a little bit quickly. I want to show you a tool that you can use for evaluating and identifying AI tools. But identifying the decision maker, gathering other stakeholder input is important to the team structure. Your checklist for things that you can think about as you are moving into this process. and a couple of takeaways for you as we wrap up, starting with the five essential questions, looking for healthcare specific proof of use and in your context, and coming at this solution without emotion and a system of evaluation will help assure that you've got a good decision in the end. Wanted to share a bit about what PEAKE is doing to help you navigate this process. And it's a solution and a platform that we call AI Lab. It's available starting today at the PEAKE website. So if you go to peaktechnology.com, resources, AI Lab will take you to this platform that will allow you to identify AI tools that are built for your practice. And I'll take you directly here and we'll go and look at the PEAKE AI Lab together. So if we stand by. I mentioned peaktechnology.com. Under Resources AI Lab. You can also go directly to peakailab.com. What we're doing with AI Lab is identifying as many of the AI tools and solutions that we can in the marketplace, bringing those together into a catalog essentially, organized by category, tagged with information that is critical to your practice, like the EMR, the specialty of your practice, and bringing those into an environment where we've done our expert review as well as pulling in user reviews. So from the AI Lab, you can learn more about our process for evaluating AI tools, many of the things that we've talked about today in terms of how we approach looking at the tools. And then we have our own framework of 8 items that we're moving through as we're looking at each AI tool. Within the AI listings, you're now then able to search for a specific tool if you have one in mind, or narrow down to a category of tools, and then also look directly at your EMR to see which tools in a particular category are available for your electronic health record system. Once you dig deeper, there's no charge for PEAKE AI Lab. There is a very light registration process that occurs. And then once you're in, you get to see our review, a further description of the product, information about our rating system, all the compatible EMRs, EHRs, and other tags that are associated with this review. So we're launching with about 60 AI products in the catalog, and we'll be expanding that weekly to include other tools for your consideration. So this is a resource for you to use. Again, there's a lot of noise in this space, but we want to do our part to help break through that noise and to put tools in your hands to find AI tools that will be meaningful for your practice. So we're here at the end. I want to say thank you for joining. It looks like we've run out of time. Not a good opportunity for questions, but you're certainly welcome to follow up with questions through the emails provided, and we'll also send a follow-up link. We love to help you through this process. We'd love to work with you as your IT provider or your security services provider and be of any help through this process that we can. So thank you again for joining and for your time, and we'll see you on the next webinar.